Welcome back for another update of the SARS-CoV-2 and COVID-19 situation in Thailand. I hadn't expected to make another video so soon, but with some big news came out today. Today's video we're going to look at how the current screening efforts rely on our honesty and openness about travel history and symptoms, as well as the possibility of an uptick in cases locally in Thailand. I'll look at where local transmission is occurring and how many local cases are reported in Thailand. And we'll close with a look at the local and global travel restrictions and their relationship to disease transmission status. Let's quickly check the global situation. As of 1 p.m. Thai time on February 26, we have more than 81,000 cases globally with 2,765 deaths reported. We see that South Korea is now over 1,000 confirmed cases, with deaths in South Korea, Italy, and Iran all reaching double digits, reflecting the sustained community transmission that's occurring in those countries. But the big news out of Thailand today shows how crucial openness and honesty is in our current efforts to detect and respond to the virus. This morning, it was reported that a man had checked into a hospital with pneumonia and flu-like symptoms and lied about his recent trip to Japan. This took place at B-Care Medical Center, a private hospital just north of Don Mueang Airport near the Rangsit area of Bangkok. The man arrived at the hospital on Sunday, February 23rd, with a cough and a fever. However, when asked whether he had traveled abroad, he said no. After being admitted and spending a night in the hospital, he was questioned again on Monday about whether he had traveled abroad, and he lied again and said he hadn't. Not until later on Monday morning did he admit to having recently traveled from Hokkaido Island of Japan, where sustained community transmission of the disease is occurring. As a result, probably more than 100 people have possibly been exposed. What we know is that a 65-year-old man, his wife, and at least one other family member went on a group tour to Hokkaido from February 16th to the 20th. And on February 20th, they flew back from Sapporo to Don Mueang Airport on AirAsia X flight XJ621. And on that day, the man started experiencing flu-like symptoms. Presumably, his wife began feeling sick at that time, too. We know now that both of them were sick with COVID-19. They didn't know yet, though. So it's likely that people may have been exposed at the airport, on the flight, and others on the tour. After returning home, the elderly man and his wife were in contact with two grandchildren, one aged 8 years old. We know now that the 8-year-old has tested positive. The other child is currently showing symptoms, but test results are pending. But they went to school and possibly exposed people there. On Sunday, February 23rd, the man admitted to B-Care Medical Center but denied any travel history. Therefore, at least 30 or 40 medical personnel and patients have possibly been exposed. Additionally, it's been reported that one of the family members that was on the tour works at a bank and has been at work since returning from the trip. And finally, contact tracing will have to be done to see about others on the flight and in the tour group to find out who else may have been exposed. All told, it's easy to see that more than 100 people have possibly been exposed and will need to be closely traced and monitored. This incident highlights how screening and detection methods rely on our openness and honesty. The patient likely lied about his travel to Japan because he knew that if he had said he traveled abroad, he probably would have had to go to a different hospital. Private hospitals like B-Care are not equipped to handle and isolate infectious disease patients usually, and they would have had to refer to another hospital. And it's likely that the patient feared this inconvenience. The 3 confirmed cases announced today are the 65-year-old man, his wife, and the 8-year-old grandchild, which brings Thailand's total to 40 confirmed cases now. I believe we will expect to see more cases in the coming days. In the press conference announcing Thailand's new cases today, including the elderly man at B-Care, the health minister has reminded all people who have traveled from any high-risk country to report their symptoms immediately. The important message here is that we should, as a common courtesy to others, provide our recent travel history. Thailand is not an authoritarian country, at least not like China, and it's unlikely any drastic measures such as tracking or passport checking will occur in Thailand, so the ability to control the disease is dependent on people honestly declaring the truth. Let's take a step back now and see how the disease transmission is starting to move towards pandemic status. As a reminder, a pandemic is defined as when a disease is spreading across many parts of the world at the same time. Looking at this data about cases outside China, we see that locally transmitted cases, shown in green, are now driving the majority of cases outside China. This is a sure sign of a pandemic. Where in the world is local transmission occurring? We can look at the list of countries that have reported locally acquired infections. Locally acquired infections are infections where the point of exposure was in the host country. This should be differentiated from imported cases, where someone got infected elsewhere and then entered the country. At the start of the outbreak, nearly all cases outside China were imported. However, as we saw in the last graph, now most cases have no clear link to China. As of 2 days ago, these were places where locally acquired infections had occurred. Of course, many of these numbers are much higher now, but it's more my purpose here to create a list. However, we should distinguish between different degrees of locally acquired infections. Among locally acquired infections, the worst case scenario is to have sustained community transmission of the disease. This is occurring in China, South Korea, Iran, Italy, and Japan. In these places, new infections have no clear link to China or international travel, and their origin is often uncertain. The disease is present and spreading in these places. These are places with the highest risk of transmission, and all non-essential travel should be avoided. The patient at B-Care had traveled to Hokkaido, but lied about it to medical personnel. So what about in Thailand? Well, currently most of the 40 confirmed cases are imported. About 9 are local transmission. These numbers may change a little as more information becomes available, but this is our best guess at the moment. The good news is that while local transmission of the virus has occurred in Thailand, it is not to the level of sustained community transmission. However, our concern is that with today's incident at B-Care, we may have unleashed a wave of infected people around Bangkok. We'll have to monitor this closely over the next few days. The success in contact tracing and quick isolation will be critical to that success. I'll close with what the US CDC is recommending for travel restrictions. They have 3 levels of travel alerts. Currently, China and South Korea are classified as level 3, where it is recommended to cancel all non-essential travel. Japan, Italy, and Iran have currently level 2, where it's not recommended for high-risk individuals to go, and all others should reconsider whether travel is necessary. I suspect some of those may be upgraded to level 3 soon. Finally, Hong Kong is categorized. Currently, I don't think there is a major risk to traveling to Thailand. On the other hand, we here in Thailand are worried about bringing the disease in. Many universities and institutions have enacted their own policies. For example, my university, Khon Kaen University, announced a policy on February 24th that anyone who travels or transits through a list of 12 countries must self-isolate and monitor health conditions for 14 days after returning. These countries appear to be basically any country that has locally acquired infections. Like I said, at the moment, there's no evidence that widespread transmission of SARS-CoV-2 is occurring in Thailand. However, we must monitor the situation closely. While I wouldn't recommend canceling your plans to Thailand now, you should accept the possibility that you may want to cancel your plans in the future in case the situation changes. 1 week ago, nobody would have recommended canceling your trip to Iran, Italy, or South Korea. And we see how that situation looks now. It can change quickly. Thanks for watching. Thanks for all your comments on my last video. Give me a like if you like the videos, subscribe for future updates, and check out other videos on the COVID-19 situation in Thailand. See you next time.